Hi everybody, Dr. Daniel, and today I'm talking about an interesting subject. What should you do for a severe migraine? Boy, wouldn't you like to know the answer to that? I have some ideas. Migraines are prevalent, 12% of the population. They're severe and described diagnostically as being moderate to severe, disabling, because they'll put you to bed, and associated with disagreeable symptoms like photophobia, which is fear of light, sonophobia, which is fear of sound, osmophobia, which so that smells make you sick, nausea, which is an upset stomach, and vomiting, so you feel like, where's the paper bag? Really, it's a chronic, genetic, episodic, long-term neurologic problem. What could be worse? Many persons with migraine never figure out what they have to do. They survive the attacks somehow, but do not have an organized plan. So, considering the usual outcomes, what should you do for a severe migraine? To treat a severe migraine, I have a list of several things that should be done, and I'll give you the list and I'll come back and individually discuss them. Stop what you're doing now and give in to the headache. Lie down. Get in the dark. Get in the quiet. Hydrate with fluids. Go to sleep. Use ice packs. Turn off your cell. Take your medication early, preferably a triptan. Later, see a doctor and get on a preventive medicine if you suffer 3 or 4 migraines a month. After the attack, do the migraine lifestyle and meet the right doctor. And these doctors are Dr. Rest, Dr. Eat Good, Dr. Sleep Right, Dr. Low Stress, Dr. Nature, which means get out and walk and see the world, and Dr. Exercise. Additional questions. What's the deal about lying down with a migraine? The International Classification of Headache Disorders, version 3, which is the standard reference for migraine classification worldwide, states that persons while suffering a migraine find that, open quote, activity worsens the headache, close quote. So being up makes it worse. Many persons with migraine think, not again, when they first notice the headache coming on, as an inkling of pain behind their left eye, for example, and they may choose to ignore the initial symptoms and see if they will just go away. Sometimes this works, and the reluctant migrainer finds the headache abates. But this is a gamble, and usually that unprepared person with migraine finds the whole world comes down on them as they develop a severe, untreated migraine that upsets their day and sends them home from work mid-morning in a work colleague's car with their tail between their legs. For treating a migraine, it's better just to give in to it. Take your medicine and lie down rather than take a dangerous risk with a migraine that may last all day or several days. Why is it better to get in the dark with a migraine? Migraine comes with photophobia, a neurologic symptom meaning fear of light. Photophobia during a migraine is pain caused by retinal exposure to light. The retinal fibers behind the eyeball connect to the 5th cranial nerve, a sensory nerve which carries pain. The trigeminal nerve is activated by the migraine neurophysiologic process to cause pain during a headache. This is usually pain on one side of the head behind one eye. Migraineurs want to get into the dark because it helps their headache pain. They feel a little better in the dark. Why is it better to get into a quiet place during a migraine? Migraine aggravates the sensory nerves for pain in the face, the 5th cranial or trigeminal nerve, and the sensory nerve for vision, the optic nerve, and the retinal fibers behind the eye. Migraine also inflames the 8th cranial nerve, which carries hearing, so that small sounds the migraine person will experience sound very loud and aggravating, so they feel better in a quiet place. How does dehydration provoke migraine? It's not clearly understood medically how dehydration aggravates migraine, but it does. Normally, we need 64 to 80 ounces of fluids every day, and losing 1 to 2% of the body fluid can cause dehydration. Years back, when I was looking for an internship, I met a doctor from a Midwestern medical school who had invented Gatorade. Wow, he probably made a lot of money. That was the beginning of treating dehydration with balanced electrolytes and water, a concept that is dogma now in sports, drinks, and things like that in workouts. Consider rehydrating with plain water, Gatorade, or a similar sports drink when your migraine comes on. Go to sleep. I know this is going to sound empty, and I don't know how it works, but many patients have told me that going to sleep will get rid of their migraine. That's probably hard to do, to go to sleep in the middle of severe headache, pain, and nausea, but some persons are able to do it. Sleep sort of resets the migraine brain, but long sleeping, like a 4-hour afternoon nap after severe migraine, will set the headache off again. So it's okay to sleep off a migraine with a couple hours sleep, then get back on your regular daily awaken in the morning, go to sleep at night schedule. They also say their headaches get better if they vomit, and I don't really understand it either, but I believe it. How does ice help a migraine headache? Well, a backwards way to look at this, I think, is to look at internet sites on Pinterest or Google for headache treatment, and you will find an enormous number of treatments offers using ice. There are ice bags and ice sacks and ice hats and so on. It's pretty obvious that ice is a popular and sought-out over-the-counter treatment for migraine headache. I am the father of 5 kids. We've always kept an ice cube wrapped inside a blue bunny in our freezer, always. My wife calls it the boo-boo bunny, and she puts on anything like a child's injury, that we call boo-boos, that hurts for the kids. And grandchildren now I'm working on bumps on the head, falls to the ground on the hip, and so on. The reason we do this is because ice treatment helps pain, and it helps the affected migrainer to put an ice pack on their head during a migraine. Shoot, they even do this in the ER for any kind of traumatic injury. Remember Robert Frost in his poem said, "Ice is nice and will suffice." How does the advice to turn off your cell help? Most persons realize that cell phones have good and bad issues. They're great for phone calls or to recall someone because you don't have to re-enter the numbers. And when they connect to the internet, watch out. Anything is possible. A guy at a male study group I attend weekly always pulls out his cell phone to win his arguments. They store a tremendous amount of data. They wake us up in the morning and remind us what to do every day. But my heart sinks when I see a young married couple sitting at a restaurant and independently reading their cell phones. Cell phones destroy talking and human relationships. So, as a doctor, I want my patient with a severe migraine to just rest, not surf the net or text somebody. I also want them to rest their eyes by closing them because of the light and photophobia and all that stuff. I often advise them to not watch TV or read with a severe migraine. Can't people just lie down and rest and do nothing for a period of time? I say to them, I'm a doctor, that's what I want. I know it sounds difficult. Next, take your migraine medicine at headache onset, preferably a triptan. Only triptans can give 70 to 80% of migraineurs a headache-free experience at 2 hours. No other drug can do this. Over-the-counters like ibuprofen, naproxen, or Excedrin help some, but many persons with migraine tell me they just don't take anything available to them without seeing a doctor at all because the over-the-counter drugs just don't work, so they just suffer. You have to see a doctor to get a prescription for one of the 7 triptans, and then also oftentimes that will be sumatriptan, the most popular. There's a list of acute therapy options to be taken when the migraine starts, listing from simple to more complex in effectiveness. So you might try over-the-counters and then triptans next, like that. A tip regarding migraine therapy: rebound potential means that one may develop medication-overuse headache by over-treating with over-the-counters more than 15 days a month, or with triptans more than 10 days a month. Over-the-counter drugs. So aspirin, 5 grains with caffeine, Excedrin, Vanquish, you can take it and repeat in 2 hours and things like that. You can also use Tylenol. Persons who will take prescription drugs like Cambia, Capricot in the old days, they're not using that so much. You can try DHE. There's a Timolol eye drop that helps. And then with the triptans, there's a long list of those 7 drugs. Now, last year, 2020, there were some new drugs that came out, but they're all name brand, so they're expensive. They don't work really as well as triptans for migraine. So I see them as drugs that could be taken for persons who have a reason not to take a triptan, like someone who's had a stroke or heart attack or is out of control, high blood pressure, or people for whom triptans just don't work. You could try it then, but you got to see a doctor. You need name brand, expensive drugs. There are also some medical devices. One's called Cephaly, which is a little thing that goes on your forehead, kind of stimulates the trigeminal nerve. And there's a thing called Gamma Core, which is a vagus nerve stimulator. You can put in the neck, it helps. Now, later on, you should see a preventive doctor and get on preventive medicine if you suffer more than 3 migraines a month. After your bad migraine's over, you do that. The number advising preventive medicine for 3 to 4 migraines comes from a general consensus among headache doctors. Only half of persons with migraine have had a diagnosis from a doctor. And there are 4 commonly used preventive drugs for migraine, been used a long time previously, called amitriptyline, topiramate, propranolol, and Depakote. They can reduce headache about 30-40%, but most patients don't stay on them very long, like 3 to 6 months. There are also new drugs called CGRP drugs, and there are 4 of those. But the results on those are amazing. So half of persons taking like Aimovig, which is one of the new drugs, get a 50% reduction in migraine headaches. And another 25% of patients get 75% reduction of migraine. And another 25% of patients, the so-called CGRP super responders, get 100% reduction of migraine headaches. And that's amazing. All the drugs work about the same for migraine prevention. So these drugs are called Aimovig, Ajovy, Emgality, and Yapeti. Thanks very much for listening to this. Please ponder what I'm saying to you and try to follow this advice. I hope it'll help you. God bless all you folks with migraine, and I'll see you again on the next talk.